and we've been talking a lot about healthcare and a better healthcare system on this show really since the beginning. But what we have not talked a lot about is how healthcare for all looks in other countries that have gotten this system more right than we have, and what the challenges might be that we would face under those circumstances as well. So our next guest has some insights about that. Dr. Danielle Martin is a family physician in Canada. She is on the board chair of Canadian Doctors for Medicare. Medicare is the name of the Canadian system. She is on the clinical staff at Women's College Hospital there. She lectures in the Department of Family and Community Medicine at the University of Toronto. And she has a new book out entitled Better Now, 6 Big Ideas to Improve Healthcare for All Canadians. So, Dr. Martin, first of all, thank you for coming on the program.
Thanks for having me.
And then let me ask you first, just as a kind of global question. I mean, I know that, you, from what I've seen of your writing, that you are a believer that, the underlying, or I believe that you are a believer in the underlying principles behind the Canadian healthcare system. That's not the issue or the question here, right?
That's not the issue or the question. And in fact, I'm not alone in that. One of the things that I think Americans sometimes find puzzling about the Canadian system is how little debate actually there is in Canada about the underlying fundamental principles that underpin our system, most notably the basic notion that access to healthcare should be based on need, not ability to pay. So support for Medicare, as we call it, the single payer Canadian healthcare system, is overwhelmingly high in poll after poll. And in fact, not only are Canadians supportive of the system, we also really define ourselves by it. So people will point to Medicare as the most important defining social program in the country. If you ask them what most symbolizes Canada, more than the mounted police, more than ice hockey, they say healthcare. And so actually that set of fundamental principles is not really in question in Canada on any part of the political spectrum. Now, that doesn't mean that we don't have serious disagreements about how to improve the system or make it better or deal with its flaws, of which there are many. But those basic principles are not in question, and they're certainly principles that I support wholeheartedly. I feel very lucky as a physician, to be able to work in a healthcare system where I don't have to worry about my patients having coverage. I just take care of all comers, and I've got my own Ontario health card, and I can see any doctor, and I can go to any hospital, and I can get the care that I need without having to worry about paying anything for it, out of pocket, or having to deal with private insurance companies or what have you.
I as an American, as a patient, I'm very jealous of you guys, and I spent a year at university in England and in London. And I remember being amazed when I went to a doctor. I mean, I knew intellectually that there was a system where you didn't have to pay cash up front to get medical treatment, but I was astonished on a gut level when I first experienced it. So I gather from what you're saying, Dr. Martin, that people in Canada, as a rule, are not looking south to the United States with envy and longing at the healthcare system we have here.
No, we're not. And that doesn't mean that we don't acknowledge some of the tremendous innovation that happens in the American healthcare system. And certainly, your country is so much bigger than ours, 10 times the size, that there are some highly specialized treatments that Canadians will travel to the United States to get, just as people do from all over the world. And so, first of all, it's not a competition. And secondly, of course, we acknowledge the areas where we see excellence in the American health system, of which there are many, but nobody is campaigning for Americanization of the Canadian healthcare system. Far from it. In fact, most Canadians, I think it's fair to say, find it deeply puzzling when we watch the debate happening in the United States right now, that it would even be a question as to whether or not every single American should have health insurance. And that is not a debate that we are anxious to have. It is not a debate that we would ever really want to have as a country. I feel on quite safe ground saying that on behalf of the overwhelming majority of Canadians. Having said all of that, none of that means that our system is perfect. It's not. We've got tons of problems that we are dealing with, just as all industrialized countries have. I think what's important to know is that we're starting from a base of shared values that is very important. Then from there, we get into the challenges that we face. And that's why I wrote this book, because I wanted to share the stories. It really is a book of stories about my own patients and my own family and my own journey as a doctor and a hospital administrator in the healthcare system, to try to illustrate what have we gotten right, where are we really struggling, and most importantly, what can we do about it?
And that's exactly what I want to pivot to now, but I will close by saying you're very gracious, but I think when it comes to healthcare financing, it is a competition, and the United States is losing badly. And I think, we need to up our game on that. But I also think it's important for Americans, for people in this country, to understand, first of all, the advantages of the Canadian system, but then again, the problems that persist on a human scale, so that we can be looking to the future to making improvements in our system, but addressing problems that may coexist between the two countries and problems we may face in the future when, as I believe we will, we have a better system. So tell us about the problems you've seen and the 6 big ideas that came out of that.
Well, one of the things that I talk about in the book is that although we're very lucky to have established universal public health insurance for doctors and hospitals, we made a fundamental mistake in the design of our financing system by not including prescription medications from the outset. And it has proved to be, over the last 50 years, unbelievably difficult to reopen that conversation. And so we find ourselves in the bizarre circumstance now where if you're living in Canada and you get sick, you need to see a doctor, or you're admitted to the hospital for whatever reason, you can have, you can be admitted to the intensive care unit, you can have MRI scans and CT scans and PET scans and surgery and all kinds of interventions, and no one will charge you anything, and including IV infusions of medications and chemotherapy or whatever it is. But the instant you leave the hospital and set foot on the sidewalk outside with a prescription in your hand for your ongoing medically necessary medications, you are on your own. And Canada is the only country in the developed world that has universal health insurance that doesn't include prescription medicines. And so I talk in the book about the story of a patient in my practice, who I call Ahmed, who's a cab driver in downtown Toronto, who can't afford to take his meds. And we have millions of Canadians in the same boat as Ahmed, and I talk about the impact on his health and his family, and also the impact on the healthcare system, because you can imagine that for a person like Ahmed, who's got diabetes and high blood pressure and a number of chronic medical problems that he needs to manage, if he can't afford to fill his prescriptions, he's going to end up, unfortunately, in the longer term with complications from those chronic diseases that are also going to be very expensive for the healthcare system. So it's not only bad for him, it's a stupid move on the part of the healthcare system, penny wise and pound foolish, as we say, to pay for the medical care and the hospital care, but not the prescription medicines. Now, many Canadians have private insurance through our employers that covers our prescription medications. And quite a few Canadians also have access to public insurance if they're on social assistance or they're seniors. So it's actually quite similar to the American model for general health insurance, is what we basically have for prescriptions. You might have private coverage through your employer. You might qualify for a public plan if you're poor or living on assistance in some form, or you might be uninsured and therefore very vulnerable to not being able to take your prescription medicines. And there are millions of Canadians who don't take their medicines as prescribed because of concerns about cost. So if we were starting over again as a country, I would say that is a mistake that we made by not including prescription medications from the outset, and perhaps a lesson for our our colleagues south of the border to consider.
Absolutely. And I'm really glad you brought up the cost of prescription medication. And again, we're talking with Dr. Danielle Martin about her book regarding the Canadian system, Six Big Ideas. Better Now, Six Big Ideas to Improve Healthcare for All Canadians. I think the pharmaceutical, that's our, our bête noire here. And I guess you're bilingual. You guys know that. But all right. It's kind of the thing that haunts us most. One of the things that haunts us most here in the United States, and I guess it's a shared problem, is even though pharmaceutical costs are lower in Canada than they are in the United States, in many cases for the same drugs manufactured in the same pharmacies, and we've talked a lot in this country about the importation of Canadian drugs to reduce costs, but nevertheless, if the drug costs are still can be quite high for the average person's budget. And if, as a result, they're not getting the needed care, it's a human tragedy. And as you say, economically makes no sense either. So, it sounds like a patchwork system, much as our entire system is. What are the chances for making it better? Don't you run up against, or do you run up against, the influence of the drug companies? I suppose on the one hand, they might want the coverage because they'd have more customers, but on the other hand, they wouldn't want additional price controls, so they might resist it. Is that an achievable goal, to get Canadian Medicare to cover drugs?
Well, you put your finger on the issues. I mean, we in Canada, although it's true that our prices on average are lower than those in the US, our prices are the second highest in the OECD. So second only to you guys. I'm not sure that it's, I would advise you to aim higher as you design your programs than what it is that we have designed. And so we're looking, across to Europe and to Australia and New Zealand and the kinds of prices that those countries are paying, and realizing that we are being massively overcharged. We pay 30% more than the OECD average for our drugs in Canada. So I think it is actually a shared problem, and perhaps even a problem on which we could see more cross-border collaboration. Having said all that, what are the chances? Well, every decade or so, it seems like a window of opportunity opens up here in Canada to have this conversation about national pharmacare, as we call it, to bring drug prices down and improve coverage. And so far, those windows of opportunity just open and then they close again. And we're not in a situation right now where there's active planning going on for pharmacare to be put in place, but there's certainly a lot of active conversation. And this is something that gets raised in our newspapers on a daily basis and by our politicians. So certainly the medical establishment has been very active and vocal in advocating for pharmacare. And yes, there is resistance. We see resistance from the pharmaceutical industry. We see resistance from the private insurance companies, and in some instances from retail pharmacies. So it's a complex file, and I actually think that we have something to learn from what's happening in the US about how to try to address that kind of gridlock, because the situation we find ourselves in for prescription drugs is not all that dissimilar to the situation you find yourselves in for health insurance more generally.
Well, I love the idea of cross-border collaboration, and I think that's a great idea, and I'm glad we're able to be instructive as we bang our heads against the wall here. And I do believe that someday we will advance, and I believe the Canadian system will advance as well. Dr. Martin, we have about a minute and a half left, and I know you had 6 big ideas. I think we only got to one of them. Any further thoughts for our audience in closing? Well, or any additional ideas you want to touch on?
In this book, actually, there are a number of ideas that I think are relevant to the American context that have to do with reducing harmful and inappropriate overprescribing and overdoctoring, trying to challenge this notion that more is always better when it comes to healthcare, and understanding the harm that can come from too much medicine. And I talk a lot about reorganizing resources in the healthcare system in order to improve health. So while it's not a book about the American context, I do actually think that there are many challenges that we do share, and many of your listeners might find it worth a read.
Oh, good. Now, is that a problem, just in closing, is that a problem of incentives, that there are incentives to overtreat? And I see that you're in the Department of Family and Community Medicine. Do you have the problem we have in this country, where we tend to underpay frontline clinicians and primary care practitioners and overpay specialists, especially for doing highly paid interventions and tests? Do you have similar issues there?
It's a general trend. I would say that our differentials are not as wide as they are in the U.S. And but the majority of Canadian doctors do still work on fee for service. I think some Americans, sometimes Americans tend to think that or believe in this myth that Canadian doctors are sort of state employees and that medicine is delivered by the government. It's not. We have our insurance plan is public. But doctors are still, the overwhelming majority of our doctors are still in private practice, and they are paid on fee for service. So a lot of the kinds of incentives that we see in the American system persist in the Canadian system. I would say that the for-profit drive is much less here, and so the problems I think it's fair to say are magnified in that highly kind of profitized environment that your healthcare system is functioning in. But they actually exist all over the world. And this problem of undoing the harms of too much medicine extends actually internationally. And it's a movement that is building to try to dial back some of that harm. And I think it's a problem for people on both sides of the border.
Well, we have a million things we could talk about, including the issues of antibiotic resistance and everything, a million ways that manifests. Unfortunately, we are out of time, but the book is Better Now, 6 Big Ideas to Improve Healthcare for All Canadians. Our guest is Dr. Danielle Martin. Dr. Martin, thanks so much for coming on the program.
Thanks for having me.